Here are 10 effective tips to fix your knee pain. These are all just my thoughts, my suggestions, and my personal opinions. And I want to start with a few general tips and then we get into some more specific exercises. It's important that if you are experiencing knee pain, that you need to take ownership first. With so many things and areas in your life, you need to take ownership over your situation. And of course, accidents happen and then it's unfortunate, you will heal from it. Usually it's okay if you do the right rehab and take good care of yourself. But this is not what I'm talking about here. What I'm talking about is the knee pain and the situation you're in, and you might not even know why. Oftentimes we do certain things that build up over a long period of time, and then it seems all of a sudden we have back pain, we have knee pain, all kinds of things, but it's really this build up over a long period of time, this input you're giving into your body for a long time. And then there's just one more thing, the straw that breaks the camel's back, or however the saying goes. So take the time to investigate what is going on, why you are in the situation, and hopefully with those tips, it will give some more guidance what areas to look into. There's no overnight fix. All the videos that tell you this will fix it overnight, immediately, instantly. Usually it doesn't work like this. It can provide relief, but to achieve long-lasting change, it is a lot more complex. And that's why I want to remind you that it took some time to get to this place, although it's not a nice place right now. And it will take some time to get out of it and really change your body, get out of that knee pain. Feel good in your body again and hopefully return to those activities that you love so much. That's why the first tip is a reminder to be patient. The body wants to heal, it's meant to heal. If we provide the right input, we support it on this quest, but it always wants to heal itself and it also has the capabilities to do so. Now, this is a very general video for a wide audience. It might not be enough of information for your specific situation. So if you are in the need for individual advice, go to a certified trainer, structural integrator, or anyone else that you trust that also has the skills in providing individual practices and individual tips. Many people are not even aware of the different options they have. And there are so many options for pretty much anything in life. The one I suggest is structural integration. So if you can find a structural integration practitioner or therapist near you, they will definitely give you more specific advice and suggestions, what's going on in your body. They will offer body work and also give you homework and tips to work with your body when it comes to movement. That's of course not something I can cover in this video, and I will also not give individual advice in the comment sections. But if you are ever in Las Vegas or wherever I'm at the time of you watching this, I offer structural integration and we can book a session and we can get to work together. It's important to do a full body weight practice every single day. This doesn't mean going hard every single day, but just some holistic movement practice every day that's very generic, that is not specific for certain areas or goals of the body. It's simply moving the body in all directions, expanding in all directions, creating space, creating strength, and then filling all of that with breath and with awareness. Most of the activities we do, soccer, tennis, martial arts, skateboarding, whatever it is, they are for the most part very specific activities. And if we only train in a specific way, we create a lot of imbalances in the body that the body, of course, because it's smart, is compensating. And so everything is in relationship to another, and by doing mostly specific training, you just change the whole relationship and your body adapts and gets really good at this specific demand. That's why it's important to counter all of the specific training with some holistic, general movement practice every single day. It needs to be sustainable, it needs to be part of your habit, ideally in the morning. 20-30 minutes is already plenty. You can do a lot in that short amount of time. And personally, I suggest my beginner 30-day calendar to really get into a habit. All the classes are about 30 minutes long for each day. You don't have to think about anything. You just follow the calendar step by step, day by day. And there you have your daily generic movement practice. Something that's always overlooked, I feel like still today, is walking. Walk more. So if you're living in a place where you drive a lot or take public transportation, you have to make a conscious effort to walk more, to park further away, to take the next bus or subway station if you have time, and make time. It's about the priorities, and then walk a little bit more. 10,000 steps a day is a good start and also a good beginning goal. It's not that important that you track each day and count the steps and get obsessed about more and more steps. Eventually there will be the intrinsic motivation of feeling good by just walking, and the body is literally born and meant to walk. And that's something that's increasingly going away. By sitting more, driving more desk jobs. Generally walking more is great, but specifically for the knees, to strengthen the knees and help you on this journey to get out of knee pain, is walking backwards, especially uphill if you can. You could walk on a treadmill and just have it a little bit inclined, and then you just walk backwards, maybe with the treadmill off, so you just have enough resistance to extend the legs. But if you can spend time outside, that's always preferred. Being in nature, being with fresh air, having the sunshine on your skin is always the preferred method of movement and exercise outside. Your shoes have a very big influence on your feet and your whole body, in fact. There's this huge trend about barefoot shoes, and for the most part I also wear barefoot shoes myself. So this is already a really good start. But if you only wear barefoot shoes with basically no support on a flat concrete surface the whole time, it's also no good, because we are not designed to walk on such an artificial surface. Yes, we are designed to walk barefoot, and the feet don't really need any support. That's why barefoot shoes are great. But if you only wear barefoot shoes on flat cement, it's also not good. So that's why it's good to have different shoes that you're rotating through, so that your feet and your body doesn't really get used to one specific type of footwear. Having some very minimal barefoot shoes is great. Having some sandals that could be barefoot, having some shoes with a bit more of a sole, a bit more cushioning is also great. Flip-flops, not so good, but any other kind of shoe that also supports and holds on and snugs to the whole foot is good. And then it really comes down to the variety of the sole, and that's usually enough to rotate through. And if you can, when you're walking with those kind of shoes, rotate through different surfaces and terrains you're walking on. Could be the forest floor, grass, sand, the concrete, flat surfaces, or some rocky surfaces that's uneven. That provides all really good input for the feet and all the way up through the body. But you need to work with what you have, and if you live in a big city and there's no park and no mountains and forest and all the awesomeness available, and all you have is your concrete cement neighborhood, then you just walk there. These are some generic tips. Let's look into some specific exercises that you can do. Split squats is a great exercise that you can do without any weights, just wherever you are, in your home or outside. And then once you feel good at doing split squats, you can also add weight. But the quality of movement is more important. So focusing on good quality movement and form is key before you add any weight. You come into a crescent lunge and you shorten your stance, and then you let the arms hang down by your sides. I like to hold the weights in both hands, or put the thumb inside the four fingers and close the hand. And then you shift with the front knee forward, coming as low as possible with the knee driving forward. Allow the front heel to lift up. You can then just come into your maximum range that's accessible right now, and then come back up, straighten both legs fully, and go for repetitions. I recommend 10 to 20 or even 30 of clean repetitions. With these kind of corrective exercises, it's not so much to focus on maximum strength with lots of weight and low reps, but more on higher reps to increase blood flow and also supply of nutrients. Toe raises are great to strengthen the tibialis anterior. This one is nice to do leaning back against the wall, just staying on the heels, and then you lift the toes and the balls of your feet up and down. And again, I recommend doing 15 to 30 repetitions. I will have more of an exercise plan, so to say, in the description below, so make sure you check that out. Tibialis anterior is part of the superficial front line and is also supporting the knee from below. Generally, what's happening in the knee strongly depends on what's going on below and above. A lot of these exercises I suggest here are full body, or at least lower body, so they address the areas above and below the knee, and the knee directly as well. Heel raises is, just like the name suggests, a nice exercise to strengthen the tibialis posterior, which is part of the deep front line and is also supporting the stability in the knee and the sense of lift and resilience and evoking the core. To do heel raises, you can just stand on a flat surface and start to elevate the heels as high as you can, and then lower back down so that the heel is almost touching or fully touching the ground, and then you lift back up. You can hold on to something with one hand or even with two if you find this challenging for your balance. If you want to bring the heel raises to the next progression, you can use, for example, a staircase or some kind of block or something that's elevated, where you can put the ball of your feet and the toes on, and then you lower the heel below the toes, and then you lift up as high as you can. That provides a nice lengthening for the deep front line in the lower part, especially tibialis posterior. And you have to use strength and contraction from this lengthened position, which overall again increases the sense of lift and resilience through the core. And if you want to take it even further, you can use weights in both hands or in one, or even do that one single-legged. So you're only using and lifting one heel up at a time, and the other foot could be just extended out or hanging next to the other foot. So there's different ways of progressing and making this more and more challenging as your form continues to improve and becomes really clean and solid. Only then I suggest to progress with the heel raises. Oftentimes the knee is thought as a purely hinged joint, and most of the time this is what it does, but it also has the ability to rotate when the legs are bent. And so this rotation is what most people don't really have. Hence I recommend knee cars, controlled articular rotations for the knee joint. I have a specific video you can check out. I will link it also below, where I guide you through the knee cars, and that's something I recommend to integrate into your practice, maybe even daily, especially if you are in a strong need at the moment, but at least a few times a week. That will teach your body and nervous system to allow rotation in the knee joint, so that when you are going through day-to-day life and then you come into a situation where your knee requires rotation, if you don't have it, you will get injured. Then the force that's coming into the tissue is greater than what the tissue is capable of handling, and then usually injuries happen. Then there are also specific mobility exercises for the knee, for internal rotation and external rotation at the knee joint. Those I will also link in the description below. You can follow along, check those out and integrate them into your practice. Like I said earlier, what's happening in the knee strongly depends on what's going on above and below. So it's always helpful to work on hip mobility and ankle mobility. More hip mobility than ankle mobility, since we're just sitting all so much, and pretty much everyone has zero capabilities for internal rotation in the hip joint, because a lot of things that we do are external. Even with things like a yoga practice, most of the movements and poses are bringing the hip into, or the femurs into, external rotation. So we want to work for internal rotation and the capability to rotate inwards, not just with range of motion, passive, which is flexibility, but actually be able to control this range of motion with specific mobility training, which is pretty much strength training for the joint. And I have a video on that as well to practice. Check the description below to get started. External rotation is also helpful. I recommend to do both, but a bit more focus on internal rotation, especially if that's something you hear for the first time. And just to make it complete, I will also add some videos for ankle mobility. Over the past years, I've created so many videos for all these specific things, and this video is hopefully a good overview and gives good direction and guidance, what to look into, what to consider, and how to get started. Be patient with all of this. I trust that you will heal, your body will heal. If you prioritize this and take it seriously, start reevaluating how you're treating your body in terms of training, specific training, recovery. No one's getting younger, and so it's all about aging gracefully and with vitality. Have a wonderful day, and I'll see you soon. Peace.